Hello everyone, this is CatchLife Dental. Before we even start, I'd like to remind you the dates that we're going to be in UK for our meeting events. The first one is 11th of October in Bristol, second one is 12th of October in Birmingham, third one is 18th of October in Leeds, and lastly 19th of October in Manchester. These are our upcoming events that we're going to be here there with our dentist and also our plastic surgeon to meet you there. So today we'll be talking about and discussing about aligners, which we generally know about its product name that is normally just sold in USA as far as I know, which is Invisalign. But these are aligners. There are many other brands as well, like Clear Correct aligners and Otero, and many more. And we will be opening this subject with our dear orthodontist professor, Elçin Esenli. So first of all, who is Elçin Esenli? So can you just introduce yourself to our audience?
Thank you so much. So as you told, so I'm a professor, Dr. Elçin Esenli in orthodontics. And 28-year dentist and faculty member of a university and co-founder of the academic clinics with CatchLife. So today we would like to talk about aligners. It's very well known like Invisalign, but Invisalign is just a brand name. So general name of it is aligners.
Mm-hmm.
So today we would like to talk about the aligners and comparing to other methods.
Okay, so we have basic questions regarding the aligners that we prepared, and this will be covering all that we need to know so far, and then we will be asking for your questions regarding to the aligners during this video live event so that we can just talk about it. So the basic question is that what is metal braces and what is aligners? Can you give us more information?
Yeah, it's a very good question. So basically, metal braces are the conventional orthodontic treatment methods. So this is called as fixed orthodontic treatment methods. Aligners is another treatment option, including some plastic removable plates and called aligners, and these techniques are totally different from each other.
Mm-hmm. So is there any advantages or disadvantages between metal braces and aligners in this context?
Yes, of course. So these methods are totally different regarding advantages or disadvantages.
Mm-hmm.
Basically, metal braces are attached to the teeth directly by using some biocompatible adhesives or biocompatible glues.
Mm-hmm.
But aligners are removable appliances and they are made of some kind of plasters. But
Mm-hmm.
metal braces are made of some metal alloys, and they may be produced by the porcelain material. They may be more aesthetic, but still different from the aligners.
Mm-hmm.
So the metal braces are conventional orthodontic materials, and the aligners are the more popular digital and plaster removable appliances and treatment methods. They are totally different from each other. Mm-hmm. And they have some advantages of disadvantages,
Mm-hmm.
like other treatment methods. To be honest with you, there is no perfect treatment method. So each method has some advantages and disadvantages.
Mm-hmm.
Let's start with the appearance. Metal braces. This is not a bad treatment method. So we treated thousands of patients so far by using metal braces. So metal braces are attached to the teeth. So these are fixed orthodontic treatment, but aligners are less noticeable and very aesthetic treatment methods thanks to the digital technology in orthodontics. So this is the first advantages of aligners.
Yeah.
Second, maybe the consumption diet restrictions. There is a strict diet restrictions in metal braces method because it's attached to the teeth directly, so you need to be careful about chewing and hard foods.
Nuts and,
Exactly. So otherwise, so you can break or damage the metal braces or arch wires, but there is no diet restriction in aligners because you can take out the aligners during your meals and you can put in again. But in both techniques, you need to use the metal braces or aligners for 20 or 22 hours a day. So it's very important. So patient compliance is so important in both techniques. So what else? Comparing the advantages or disadvantages.
Being comfortable or not?
Yeah.
Maybe.
Yeah, this is the very important question. We have some soft tissues like cheeks, lips, and the tongue. So if you insert something like metal braces and arch wires, so they have some bulge or so it's massive appliances. So our soft tissues need to be adjusted to the braces and other arch wires in the first week of or first 2 weeks of the treatment. But there is no compliance period in aligners, aligner technique, because they are very thin, very comfortable. So no need to adjust by our soft tissues. So I can say that aligners can a little bit more comfortable compared to the metal braces and arch wires.
Yes.
Even though alternative to metal braces and arch wires, there are some kind of porcelain and aesthetic braces. They have still create some projection. So, and our soft tissues need to be adjusted to the extra appliances in our mouth. But in aligner system, the adjusting is very, very easy for the first few days, and that's enough. So no need to more time to adjust. So this is another advantages of the aligner.
Yeah.
So we would like to take advantages of aligners for adolescent patients or adult patients. So this is very important. Of course, so there are some disadvantages of the aligners. This is not a perfect treatment method. For example, in severe cases, in complicated cases, some congenital anomalies or some cases needs to be treated by orthodontic surgery. So we would prefer to use metal braces because aligners are not proven enough by scientifically yet. So we need to see more evidence-based results about it.
So it directly related to the patient's case itself.
Yes.
It can be complex, and if there's a need of surgery, you may prefer metal braces because we don't have enough proof for aligners. But what I understand is that if it is more like aesthetic concerns, or maybe if it is crooked, aligners can be a better option when compared to metal braces.
Yes, right, definitely. So each case is different. So your orthodontist can say aligners or metal braces can be preferred is based on the patient's situation.
Yeah.
So no generalization.
Of course, like examination is first.
Yeah, exactly.
X-rays and everything, and after that,
and
we can
you
come
know,
up with it.
to be an expert is a critical situation.
Yes.
So this is not about the general dentistry.
Yes, this is important.
This is important.
Because like every patient has a different case to be examined first, so that they can come up with a treatment plan. And it's not like selling the product, but first examining the patient and define the need of the patient. And depending on that, we can go for metal braces or aligners or many more other surgeries with our professors, you know, advice and analysis. So this is the first important part that we have seen lots of cases outside who are not, who doesn't have enough knowledge about the procedures beforehand. So please research more and know who to contact regarding your treatment. So I have also another question in mind regarding to metal braces and aligners. Do we have any time difference, like the treatment time? Does it take 2 years, 3 years?
Yeah, this is very important and very good question. The most common question is which one is faster? So there is no enough evidence-based results about the treatment duration. So there are a very few studies on comparing the treatment duration between aligners and metal braces. So based on these very rare research suggesting that, so the treatment duration is a little bit shorter in aligners, but we need to see more scientific based studies to be able to say this is shorter or this is faster method or this is the best method, but we have no enough knowledge about that. As I'm scientist, I would like to see more research projects about that.
Yes.
So please keep in mind that the treatment duration is just about the patient compliance and then the patient's main anomalies.
Yeah, so it's specific to the
It's
patient.
specific, so I mean, it's not possible to generalize it.
Yeah, we cannot say 2 years, 1 year, or
2
3
years,
months.
1 year, or like 6 months, or 2.5 years. So it's based on the anomalies and malocclusions type.
Yeah.
So it depends on the orthodontist examination. So there are, these two treatment methods are not comparable at this point.
Yeah.
At this point, so I'm not one of the techniques, fan of it. Just as a scientist and clinicians, I can say that every case has own treatment methods, and the treatment duration is based on the anomalies.
The patient itself, herself
Exactly,
or himself.
exactly.
I understand. So I also have one more questions regarding to the aligners. I'm sure that they will also ask it. You indicated that you need more visits for aligners, which means that the patient has to come back to the dental clinic every month, or is it about
That's
how
a
you track it?
Very good question. Okay, so I can say that with the metal braces, the patients should visit every month to the orthodontist. And with the aligners, if you trust the patients regarding compliance, you can see the patients once every 2 months.
Good.
So this is very good. So appointment time is a little bit reduced in aligner therapy, but with the classical method, so you need to visit the orthodontist every month. So this is the one of the basic differences between two methods. And regarding this issue, chair time is different. Chair time. So you spend time in the clinic is different. So with the aligners, chair time is reduced.
Mm-hmm.
With the conventional metal braces, it takes a little bit longer because the orthodontist should adjust the arch wires and engage the arch wires to the metal braces, and with the clear aligners, so adjustments are a little bit little, so chair time is reduced in aligner therapy. This is another advantage.
It is more like a laboratory work with the
laboratory
impressions.
work and the laboratory work, and then also the doctor's work.
Of course.
In the mouth.
Mm-hmm.
So it takes shorter
Mm-hmm.
in aligner therapy.
Mm-hmm. Do we
So
have
is
any
it-
preparation for aligners in this context?
No, so there's no preparation. We do scan the intraoral area by some digital workflows, and then we upload the scanning into the program. So we planned everything in 3D.
Mm-hmm.
So after that, we make a treatment plan for each case.
Mm-hmm.
So after uploading everything, the system digitized everything in 3D from beginning to the end. So we can see everything step by step from the beginning to the end of the treatment. So we will be able to show the details to the patients and the digital environment. So after patients approve the results, so we approve the treatment technique, and then it's produced by using 3D printers. So within a month, aligners are produced, and then we can apply the aligners to the patient based on the patient's situation. So patients can be in another country or another city. So we would like to see patients once every 2 or 3 months from outside patients, or inside patients we would like to see once every 5 weeks.
It's actually good because it also means that open to the tourism, they can come and visit and then go back. Does it take 5 days or 7 days? How long should they stay here for
No,
Invisalign?
just 1 day. I mean, it takes very short. So it's very easy to check everything. So it takes just a day.
It's cool.
It's very cool.
Yeah, it's even comfortable, like arriving here on a Friday and having your checkup on maybe Saturday or maybe weekdays, only for 1 day, and then you can just return on the same day, maybe.
Yeah,
right?
Definitely.
It's a perfect example.
Easy. I mean, so they can stay just overnight and then see the doctor, and they can ask the all questions, and then they can go back. So if they want to come, stay in this city and enjoying these city facilities,
Of course.
so of course that's fine, but the doctor visit is very short.
So yeah, like in general, we have the advantages and also disadvantages for both of them. And if you'd like to add anything, we're open to it. And
I would be happy, to respond to questions from the audience.
Yeah.
Or we can, record another videos about the aligners. And I would be happy to, see and respond to questions if they can, ask another time.
Of course.
So we will be here to respond to all questions for everyone.
Okay, so we have, I think, regarding both of these procedures, and if you have any questions, we are ready to answer all of them. And in the meantime, let me remind you that we were going to be in UK for 11th of October in Bristol, 12th of October Birmingham, 18th of October Leeds, and lastly 19th of October in Manchester. That we will be, holding an event. It's a meeting event that we will meet together with our patients, and so that we can just discuss about the procedures regarding dental treatments and plastic surgery. So we are ready for your, any questions, any ask for a guidance. We are here to inform you. And if you don't have any questions, we can end the call in the moment. I don't think that we have any questions so far.
Sounds great.
Thank you very much for all of your questions, all of your answers and information.
Very good questions.
Yeah, it was nice to do this. So
okay, see you soon again.
See you. Take good care. All right.